All right, good afternoon once again, and I'm your host, as always, Tifayo, and this is the Wellhouse Podcast, transforming lives one conversation at a time, where health meets holistic harmony. And on set with me is our amiable doctor, a consultant, a man who has walked the walk, who has paid his dues, and now he can talk the talk. Dr. Okay, a consultant and also an hepatologist. You're welcome to the show, sir.
Thank you very much.
How's been your day?
Very good.
So, can you give our viewers and our listeners a little intro to yourself?
Okay, thank you. My name is Tim Tokwe Oke, consultant, hepatologist, gastroenterologist, working with the University College Hospital Ibadan, in the Department of Medicine, where we attend to people with gastrointestinal and liver diseases. Thank you.
Okay, you're welcome, sir. And like we said the last time, we will be having professionals, experts in this field who will come and give us insightful advices and expert opinions on how to live a well, fulfilling, and healthy life. And yes, to get into the show today, on the 28th of July, we'll be having the World Hepatitis Day. And I believe that shows how far we've gone, or come rather, in our journey in fighting diseases as a whole. And the fact remains that hepatitis B is a leading problem, or let me say a leading disease out there that has claimed a lot of lives. As of 2022, according to the UN, over 200 million people have been documented to be diagnosed with hepatitis, both acute and severe. And between 2022 and 2024, we've had about 1.2 million addition. And over the years, we've had about 1.1 million deaths recorded to this disease. That should tell you something that this disease, I can say in a funny way, is not yet to play. But then they say that in Yoruba, that the flood won't say it won't take your house away. But you as the owner of the house, you will not let it go. So, sir, I would like to ask, can you give us a brief overview of the nature of hepatitis B as a whole?
Okay, sir. Thank you very much. So, hepatitis B is a virus a virus that preys on the liver. So, what it does, there are some types we call hepatitis A, hepatitis B, C. So, the fact that they are viruses, but that they are natural, where they feel at home the most is inside the liver, especially of humans. And they feed on the hepatocytes. The hepatocytes are the natural cells that are common to the liver. And so they feed on them. That's how they can produce and reproduce and get humans infected. So we have the most important one in sub-Saharan Africa, which is the hepatitis B virus, and which is a virus that is of major global concern, just as our host has talked or has spoken to us. So we know that a third of the world has been infected, and out of that third, we have about 350 million people who have this chronic infection over time. So that's and we know that this virus, why it's a major global concern, is that it can cause liver cancer and liver disease, which is a lot of burden on healthcare. And because at such stages, you have a lot of people who are down with so much illness. Patients keep coming into the hospitals weekly, twice weekly, monthly, and places a significant burden, a significant toll on healthcare. So, and we know that hepatitis B can be, liver cancer is one of the cancers that can be prevented just by a 6,000 naira vaccine. Thank you.
Yes, thank you very much, sir. And like you said, it is a very big concern global wise. So here's the thing. I would say that what is the most effective method for diagnosing this disease, and why is early detection so crucial?
Okay. Thank you very much. So for hepatitis B infection, we have the acute and then the chronic infection. Acute infection, usually maybe within 6 months, person has fever, yellowness of the eyes, and then few weeks after, some may go to the hospital, some don't even go, and then afterwards they feel better. And then there's the chronic infection that occurs usually after 6 months, and that's where liver disease sets in, or even liver cancer. And so there are ways we can diagnose. And what are the ways we can diagnose? We have the serological diagnosis. So, not to bother us with so much big names, surface antigen, envelope antigen, which are just parts of the virus that humans have been able to, or medical workers have been able to detect and can locate in a lab. So, if it's in the blood, usually the virus sheds most of its particles in the blood, and so we can pick them up and detect. So the common one, which most people would have had some tests before, is the surface antigen, hepatitis B surface antigen. Then apart from that, we do other tests to check the liver, ultrasound, abdominopelvic ultrasound, and we also do liver function tests to know what is really going on inside the liver, whether there's some damage going on. And then uh, medical workers have started doing more research, and we have what we call a fibroscan now, where we don't have to do a liver biopsy to know what is going on inside the liver. We can know whether the liver is getting thicker than before. And so these are some of the tests that can help us to detect hepatitis B infection and also its sequelae, the complications. And just to answer the question about the the need for early screening, we know that if patients, or if we are screened early, and this can be picked early, people can have the vaccine. If we know that uh, this person doesn't have the hepatitis B virus, then we know that we can give vaccines. Once we give those vaccines are very good, and they are able to protect against further infection. And even if the person has some infection, acute infection, we can monitor such patients and then treat them regularly. There are drugs, viral killers that we use that can treat them, and they will not go on to have liver disease or liver cancer. So, early screening is very important.
That's wonderful. Like I said, early screening is very important, and most of the time, most people underestimate, or let me say underrate, the importance of early screening. In fact, screening as a whole, because when you screen and you realize that this thing is actually evident in your system, it's a kind of problematic. And do you know what's even funny thing is this? When you tell people that you can just go and do the screening and get the vaccine, they'll be like, I never see money chop. I never see money do test. And you just laugh. You know, be wondering, what would it cost you to actually just take the pain? That food that you not eat now will not kill you. You can drink water for 2 days and still be fine. But that disease would shorten your life in a year. One person, someone can be gone in a year if I'm not
Yes,
wrong.
yes.
So what would 6,000 equates to your life, your lifespan, increasing your lifespan, ensuring that you don't die young, and that's actually a big issue. I'll take it back to that part, but then I want to I want to ask that can you give us the real importance of this vaccination, in the sense that now, can vaccination help someone who is already infected, or it's only useful for prevention?
Okay. Thank you very much for that question. So, hepatitis B vaccine is very highly effective, and is said to almost 95% in preventing infection. That's preventing. So, you hear some people will tell you that why would I have liver disease? I've been given vaccine. So, is it that the vaccine failed? Some people even tell you that it was that same vaccine that introduced the disease into them. Now, you have to sit down and speak and caution. No, it's not. It's not the vaccine. The vaccine is not. What is in it is just, they are like dead cells, but they are meant to trigger your own immune system to build up antibodies to against the virus. So most of those people would have had the infection before they got the vaccine. So once the infection is there, getting vaccinated is not going to do much at that time. So that's why it's needed especially in children. We have the vaccine schedule for our children immediately they are born. Um, Once they get it after 6 weeks, they get it after 1 month, they get it after another 6 months. So that concludes that for the children, and they build those antibodies for life. Usually, it's even said they might need maybe boosters, maybe 10 years or even 20 years. Some don't even need boosters. So it's a very effective vaccine for, especially in our climate, in sub-Saharan Africa. So, but if someone has had the infection has gotten the infection before, then vaccination might not help. So at that stage, the person has to visit the next uh, uh, hospital so that he can get really investigated and then treated afterwards. So I would say that vaccination, especially for hepatitis B, it has been a game changer, especially for liver cancer. We saw a lot of people elderly with a lot of liver cancer before, but now I think that is changing with the fact that people are getting to get the vaccination, although it's not, the coverage is still low. So we expect that through this avenue and even others, we might get to people who can also get vaccinated. And once they get vaccinated, then and they should also get vaccinated in good, because these vaccines should be under what we call cold chains. So you can have some people, they don't have good power supply, and then they still keep these vaccines there. They might be dead. The vaccines might be dead on arrival.
More
So
like inactive,
yes,
become
inactive.
inactive. Yeah.
Yes. So it's better to get it at a place, possibly the public health places, UCH, good health centers where this can be given to patients. Thank you.
Thank you very much, sir. And that brings me to the next question, and that is, what are the common misconceptions about this disease in Nigeria, and how do we address them through public awareness? And before we get into that, I want to show you a video. So, in the course of the week, we went to some parts of Ibadan, we went to J markets, and we went to UI. So the goal was to blend two sides of the city, that local side and the much more learned side of Ibadan. See the understanding they have. And I can say that the outcome, or let me say, the results were quite alarming. I can say that 85 to 90% of those we talked to, majority were just blank. Someone was even saying he heard it's a kidney disease, and someone was saying it's a disease that used to, that they breed, that used to come due to not being clean. And saying that this is HPV, sir, not cholera. So definitely this one is a stronger one. And I won't say cholera is can be undermined, because cholera, like last week we had to cholera. But this time this is HPV,
Yes.
and this one is a different game. It's a different game changer.
Of course.
It's a different one, because this doesn't care whether you are in a clean environment or in a dirty environment. If it gets to you, it gets to you. So let's get to that video, and you can see our encounter.
So ẹ káàárọ̀ sà ọdún wa àdúpẹ́ so afẹ́fẹ́ ìlọ́wọ́ yín pé ǹjẹ́ ti gbọ́ nípa àrùn tó ń pè ní àrùn jẹ̀dọ̀jẹ̀dọ̀ tó ìyẹn ká mọ̀ sí hepatitis B.
mo ti gbọ́ pa rẹ̀. Àrùn tó yẹ kó burú ni, ó dangerous gan. Though mo gbọ́n pẹ̀ bọ̀ mi fẹ́ mọ̀ much about it.
ìyẹn àti gbọ́ rí yes mọ́ pa ẹ̀.
Gbogbo ohun tó jẹ mọ́ ìmọ́tótó environment ó ṣe kókó. Ní gbogbo ohun tó máa ń fa àwọn àrùn yẹn náà ni bí ìdọ̀tí ibi tí nǹkan ìdọ̀tí bá wà ní gbogbo àwọn àrùn báwọn ti lè ṣẹlẹ̀.
Àwọn òmùlà àgbọ̀ rí ṣùgbọ́n lọ́mọdé àgbọ̀.
I don't know the effects, the symptoms, and the causes.
Okay, so Okay, can you take us to the UI experience? To the UI experience.
Have you ever heard of the disease called hepatitis B?
Ah, not much detail into it, but let's say a bit.
A little bit. Like
Just
how little?
very little. I
Okay.
don't know about it. Does it cut people lifespan?
Obviously, it
Like
does.
effectively,
Oh.
it is very, very sharp with it.
But how come we are not really so aware about it? Because if it's something as deadly as that, how come I don't really know about it?
It's a very peculiar case. The reason mean that there are other things that are actually overshadowing the severity of this because people are always saying HIV as a bigger killer, but not knowing that hepatitis B is actually a bigger one than HIV.
Yeah, I've heard about it. A number
So
of
what do you know about it?
I know it's a kidney issue and stuff. That's just
You can see.
Yes.
What do you know about it?
Okay, I do know it's, I don't know, I may be wrong, but I think it's a sexually transmitted disease. And, okay, I think they said it affects the liver. I think that's all I know about it. Okay, then there's a vaccine you take, so.
I think you know more than some already, like a lot of people.
Yes, I've heard of it, hepatitis B, and I know it's a liver infection, like it's a virus that causes liver infection, if I'm right, and it's deadly, but treatable if you go to the right clinic. So I heard about it when I had my first child, and when I got to UCH, we were told to go and do some tests, and that happens to be part of the tests we did. So yes, I've heard of hepatitis B.
Good. I guess that sums it up.
Hold on.
So, sir, looking at that, what are the things you can draw out of it?
Okay, so looking at that, that means we have a lot of work to do. A lot of work to do. And it's just strange that both on the educated or even the markets, most people didn't know about it.
We don't.
And so it's that there's a lot of work, lot of education that we need to emphasize, and it has to be everywhere. HIV, most people, there's nobody you would ask. They know about it, and but hepatitis B, maybe it's just the issue about it is that it doesn't cause illness immediately. So by the time it will cause the illness, it comes out with another name. So that's when it comes out with liver cirrhosis or liver cancer. So by that time, hepatitis B would have been forgotten, and they won't know that that's the driver.
The root cause of it.
That's the one that really caused it. So we have a lot of work to do. There are some other misconceptions that we need to address. People saying it's from dirty areas, environmental uncleanliness. No, that's even rare. It's more of what was said that can be transmitted through blood, can be transmitted through we call it vertical and horizontal transmission.
Yes.
So the vertical is from the mother to the child, and that's the common cause, the common transmission route in sub-Saharan Africa, which Nigeria is a part of. But apart from that, you have through sex and through sharing of sharps. So people go to the barbing salons, and then they say just use your own, and then the barber says I will use spirit, I will burn it with this. That's just, it's best to just have your own clippers and not use another person's. That's the way to prevent it. Then sharing sharps, injections. There's a lot of IV drugs now, IV drug abuse. So you get people using the same, they can share like five, six people sharing the same. And so if one has hepatitis B, has transmitted to the other four who were also sharing the same IV drugs.
Wow.
So that's a major cause. And then tattoos, people just tattooing and all that. If you don't get the machine, they can use it on 2 or 3 or 4 people in places where they're just doing it just unsterilized
without
fashion.
taking care of the equipment.
Yes, so that can also cause that can be a major route for transmission of hepatitis. So those are some of the blood transfusion. Some people they just give them blood. They don't check and know whether that blood has been contaminated with the person that gave it, whether he had hepatitis B. But there are some people who they are perennial blood transfusion givers. They give it for money, which is not right, and so they don't really check. So some have gotten then surgery also. So those are some of the ways one can get hepatitis. So there are some other misconceptions like casual contact. No, casual contact will not cause it. So that some people will come and say, let me just go and separate everything in the house, my spoon, my clothes, so that no, you can't do that. There's also this stigmatization, which also has to stop. Someone has hepatitis, so everyone runs away from the person in the house, going to die soon. We don't want to follow, and all that. So those are some of the misconceptions that one needs to disabuse using this avenue. Thank you.
I would even say that people with HPV are still on the light side of being stigmatized compared to those who have HIV.
Yes, they are on the light
On
side.
the light
HIV
side.
is
Once you have
related
HIV, you are
to-
seen as a carrier of death.
Yes, yes.
And that brings to the question: how does the co-infection with HIV and other viruses impact HPV treatment and management?
Okay, so thank you for that question. So with hepatitis B and HIV, so like you have two warlords fighting in the same forest or in the same enclosure. So it gets worse, but it can be inside the liver. So it can increase the time to having other things like the liver cancer, the complications that we talked about, the liver disease. So it can kind of fast forward that time to get to liver cancer. Sometimes it takes about 10, 15, 20 years to get to that. So I've seen liver cancer in a 6-year-old. 6 years.
Wow.
That was strange. So that means
than
that
strange.
genotype was very virulent, because by 6 years the mother also had, and that was the one we're still dealing with before brought the child. Said the child had abdominal tummy was swelling up, and by the time we did ultrasound, liver was hard and all that. 6 years. So we have those kind of, but HIV, other co-infections can make it even worse, getting to that final stage of that trajectory of liver cancer. So liver cancer, liver disease, liver cirrhosis can occur if someone has HIV. Then you might also need to be more specific about the type of drug, because most of the drugs that we use for HIV are also used for hepatitis B. So you might need to be more specific, and all. So, and there's no drug, even water. Even take water, you would have some side. If you take too much water, there could be side effects. So even taking drugs, a lot of side effects would affect the kidneys, could affect the liver itself, could affect other parts of the body. So you have to tinker with some of these medications, especially when the patient has both hepatitis B and HIV. So those are some of the issues we have when patients have co-infection with hepatitis B and HIV. Thank you.
I believe for everyone who is watching and listening, they'll probably understand that there is a lot that most people don't know about, a lot that needs to be understood, and so much needs to be said for people to understand that there is a lot going on out there. A lot of diseases that are really cutting people's lives short without them even realizing it. And like I said, most people just develop the issues after years. The disease has already evolved into what is now liver cancer. But then they now feel like, what is going on? How did this start? Forgetting that there was that need to actually go for a test, go for a checkup, go for this and that to ensure that everything is okay. And then that brings me to something that has been bugging me. I want to know for a fact, is this disease, is it curable?
Okay.
Or is it not?
Okay. So it's not. It's curable, so that we don't scare those that have the infection, or those that might do tests and they find out that they have hepatitis B. So usually there's what we call is a functional cure. A functional cure means that it's not going to cause any problem later in the future. Okay, so but like most viruses, they still sit where they love to be, like in the liver. So, but there's a way the body keeps them under check. So the body can keep it under check and it stays there dormant, not being able to do anything. So that's the cure that we have presently. But we know there's research going on having to ways where we can, because hepatitis C also was a dreaded one before, but we don't have that. We have it in Nigeria, but not as prevalent as hepatitis B. So more it's common in North America and Europe. So Egypt, some of Cameroon, but not as common in Nigeria. So, but now with research has been able to eradicate hepatitis C in individuals. So we're going to that stage now, and we know for hepatitis B too, we would also get to that stage. But for now, we only have viral killers. So once it brings out its children into the blood, they just do what they kill them so that they don't go about causing further damage. But the mother itself, most of the times, can just be there, staying dormant. So over time, but once the mother is dormant, in those who have had the infection, that's what we call a functional cure. And we're able to achieve that with drugs. Even without drugs, like 15% of people who have chronic infection are the ones that would later have liver disease and liver cancer. But God has offered the technology within our own system that can pull down, make the mother dormant. So, and that will not allow it to cause any. So, like 85% of people won't even know that they have it. 85%. That's one of the reasons. Maybe that's why people don't. But most people can have HIV without them not knowing. That's the problem. But most people with hepatitis B, 85% who have the chronic infection, will not even go into liver disease. But that 15% is still important, because usually the people where it evolves, where this disease evolves, are people who are very young, 20, 30, 40. That's the prime of life. And that's when you see someone being cut off from liver cancer. It's usually very disastrous and sad. Thank you.
Wow. Because that question I asked actually came from a tweet I saw. So this is a tweet.
Okay.
This came from your herbal stroke specialist on Twitter.
Okay.
This tweet was, I think, 3rd of this month.
Okay.
So he said, chronic HPB and C cannot stand this. He now said, harvest and boil the whole plant of Phyllanthus amaros and fratanus, which Yoruba called Dubisowo, and Igbo call it Ungu. I don't know if I got the pronunciation right. Say, boil for 30 minutes, take 100 ml 2 times daily, or dry and mill to powder. Add 1 teaspoon to any beverage or porridge twice daily. And then, so looking at this, I was just like, I don't know what this is. So that now brings me to the question that what role does traditional or alternative medicine play in managing this disease, and is it effective?
Okay, so I would say I must emphasize there's no scientific evidence supporting the effectiveness of traditional or alternative medicines in managing hepatitis B. But I know it's a sensitive issue, and so we must acknowledge the cultural significance of traditional practices. Some of us were fed with dongoyaro, and we still evolved and all that. So we can't just throw everything away and say it's rubbish. No, but we need scientific evidence, and if there's no scientific evidence, which is not even in alternative medicine, people are doing research and all that now. So if there is, you can't just give someone something, you don't know the content, you don't know the quality, you don't know how much of it can affect the liver and the kidney even some of the drugs that we still give, some of the entecavir, tenofovir that we use for hepatitis can even still cause liver, because everything, the way God had made is the liver is like a gate. Everything you taste, it also has to taste it. So
What I
that's
second
that's
tasting.
yes, it also has to taste it to know and remove something, sort out some things, poison. This one shouldn't go to the brain and all that. The kidneys also do that. So liver, the kidney, they are so very important. So if you just give it anything without knowing the right quantity, or even whether there's some additional poison with it, it can cause more problem. And so that's why we need to really look at this. But open communication, because then if there are many of our patients are using it, so if you laugh at these things and they will use it at your back, so you need to make them come in, let them talk to you. Okay, this is what we're using now, and then you tell them what to do. So if you think you are using this, can we test your DNA? Can we test it after? DNA is a viral load. That's to know how many copies of the virus is there. So can we test? If we test, if we find it, this is still going high, then they're just spending money, and this thing can cause liver cancer in the near future. So I would say that for anyone who is trying to use any of these drugs, the best thing is still to come to come, because most of our patients, I've never seen anyone who had hepatitis B and chronic, and we confirmed and we started medications. I've never seen anyone progress to liver cancer or liver disease. So it shows that these drugs work. So there's no need, and they might be a bit not too expensive, at least before inflation and all that. People were buying around 3, 4, 5,000 a month, but now maybe 12,000, 15. But at least it prevents them from progressing to liver cancer. I know someone who is on a liver cancer drug and is spending about 4.5 million a month. So if you can prevent 4.5 million a month, so if you can prevent that using 12,000 a month,
Wow.
it's worth it.
I need to say, wow, 4.5 million.
Yes, 4.5 million.
I remember, so let me say, an AC. Someone said, I want to read a loan. Because you need to actually have money to manage those things when it gets to that
When
stage.
it gets to that stage.
Yes, but from the initial stage,
Yes,
it's still. I mean,
easily
no amount of money can actually, because no matter what it is, if one finishes, you can make more.
Yes.
But
yes.
why wait till it gets to that level before you now do the needful? That's what the issue is. Well, I think we've gotten so far in this podcast, and I'm really glad to have you here with us.
Thank you very
And
much.
finally, I want to say that what are the measures, or let me say, what channels do you think health bodies and agencies can go through to build or increase the awareness that people need towards this hepatitis B virus?
Okay. Thank you very much. Here's a question, and we've seen it today. So it's a very important. It's a very important question. So I believe that everyone has to be involved. So we need to, like for the vaccines, the knowledge has to be dissipated so that everyone will know about it. So, and that would involve everyone, government, NGOs, policymakers, to work on and to talk about hepatitis. WHO has said that this year is eliminating, the team is eliminating hepatitis, total elimination of hepatitis B, because it's something that is achievable. Vaccines can do the work. So we need to target this, especially in our system here, where you have more of children getting from the mother. So that means you need to target that. Nobody should. We have a lot of people going. We can't stop people going to missionary homes, but they have to be involved. That once any woman comes here, you have to do hepatitis B. Some of these tests, then we might need to get to the point. That's where policymakers are involved, and people can Just like you have some rich people saying, okay, like 1% devoted to health, 1% devoted to this. So we can put that money into everyone who comes must get tested. So that's the thing. Once you get tested, then you know there's the risk for this child, unborn child, of getting this infection. So what you do next is that child has to get vaccination within 12 hours. That's what we call hepatitis B immunoglobulin. So within 12 hours, that child must get vaccinated. It's expensive. Some people, sometimes you can spend up to 120,000 to get that. So that price really has to come down. So even if it's free, then the mother, that means that child will be protected. Then after that, vaccination, 0, 1 month, 6 months, and then after that the child is protected. So those are things that needs to be emphasized. And then regular dissipation of knowledge or education about hepatitis B. Different avenues, could be radio, could be TV. We just need to get into the streets and let everyone know, because I get into the population itself and even know our true prevalence of hepatitis B. Some have said it's as high as 15%. So that's really high. So we have this high prevalence. So we need to get into the population, get into the streets, and get these people that have the infection. Once they have the infection, then they come into the hospitals. We don't have to, because we have a lot, even for our clinics. Sometimes we have to see about 20-25 new patients every day. It's a large number. And then some people we give them, you might give up to 6 months, 7 months. Those kind of people will feel like, do they want me to die? I have hepatitis B and they give me 6 months, 7 months, and all that. So we need to involve other health workers, community health workers, so that they get involved and then they can manage even at that point, because it's a lot of burden on the health system.
Wow.
Thank you very much.
Thank you very much, sir. It has been a wonderful time so far. Thank you, Dr. Oke, for
You're
your
welcome,
time.
sir.
We really appreciate you being here on the show with us.
Yes.
And like he has said, and let me add my own few words: get tested, get vaccinated. The fight against hepatitis B is not a trivial one. This is a global health concern, and for we to ensure that we rid ourselves of these issues, of these diseases, we have to be proactive. So if the government is doing their best to get people aware, you also should do your best to get yourself tested. And I will say this as a final note: agencies, NGOs, pharmaceutical outlets, join us in this fight against hepatitis B. Get signboards, get posters, get people to understand that there is something out there that kills faster than HIV. Thank you once again for your time. I'm your host, Tifayo, and I'll see you next time. Have a good day.